I heard about the headlines in Matthew Perry died from ketamine. Do you think this is true?
Dr. Murphy, you want to take that?
What happened with Matthew Perry and ketamine is no different than if somebody was very drunk and fell into their jacuzzi. Ketamine does have various particular characteristics that can disorient you and predispose you to what happened with Matthew Perry, but by no means is ketamine a toxic substance that immediately in any way caused his death. And if you think about the, even when you look at all the studies that have been done over the years, when those are looked at very, very closely, it's even hard to describe, over years and years and years and thousands of patients, there may be between 100 and 200 individuals that have died with an association with ketamine. And keep in mind that more people die in a year's period of time from overdoses of Tylenol than ketamine. So this is just so far out in left field that it's just inappropriate to have a direct association between ketamine and Matthew Perry's demise.
I did not know that about Tylenol.
Yeah, kind of
Now I'm
frightening.
not taking Tylenol.
Very easily. Seriously, you drop a bottle of that and you will destroy your liver in a matter of hours. So, and it happens 300 or 400 times a year annually. And when I refer to the known cases of ketamine deaths, once again, that was over thousands of cases over periods of years. And even then, it was associated with some coexisting disease or situation otherwise. So it's just beyond inappropriate to think that ketamine caused in any way an immediate toxic problem to cause Matthew Perry's death. So my best analogy was, like I stated before, if you're sloppy-faced drunk and you fall into a jacuzzi, you could die. Right. And he had a very high level of ketamine in his system that apparently was not monitored correctly, from what I can gather. I'll wait and see when all the further evidence comes out, but as we see it now, it's very obvious.
Well, it sounded like he was getting therapy in a controlled setting somewhere prior to his passing. And that happened a number of days, if not weeks, prior to him passing away in his jacuzzi. And, ketamine's a very fast-acting drug, right, Dr. Murphy? It's in and out of your system in a relatively short period of time. So even if he had received a responsible administration for whatever affliction he was going to a clinic for him to have any kind of problems afterwards or weeks afterwards related to that administration doesn't make any sense either.
No, not at all. Apparently it had been, I can't remember the exact time period, but it was, I believe, at least a week.
Right.
There's all the ketamine is broken down after you take it very rapidly. We call it, like, it cuts itself, the half time with which your body breaks it down happens about every 15 minutes. So it's ludicrous to think that anything where it was properly, professionally administered had anything to do with what happened to him that day. So, and the levels in his system were very, very high. Right. So there was an exogenous alternative source, some outside source where he was getting it. That would be the only way to explain those levels. And that, that brings up another issue for us, Kevin, is how do we, we need to express how this medication has to be given with strict guidance and strict oversight, and has to be given in a way where we know we can get the proper level of ketamine in someone's system. And that's why we like to do it by vein rather than by mouth or by nose or as strange as it might sound, rectally.
Right.
We do it in a way where we are very precise on both the safe and effective dosage, as we have for years and years, and as is evident by the results we get with our patients doing well.
For sure. Yeah. And we, remember way back when we first started, we tried intranasal ketamine as a compound to do some research on it. And it was really difficult for us to get consistency to the patient's response based on the uptake of the ketamine. So sometimes it would take 100 milligrams, sometimes it would take 150. But we knew with the IV, the patient's ballpark, and I'm using this as an example, if we knew that 75 milligrams worked well for patient 1, then next time they came in, sometimes we have to go up a little bit, sometimes we keep the same amount. But if we're going to do intranasal or a different route of administration, we many times were just kind of shooting in the wind. We were trying to guess at what was going to work, and it was hard to know depending on how quickly the body absorbed it.
Mm-hmm.
So IV was our solution, and we've kept it as what we feel is the gold standard of care. We've talked about it early, like there's a lot of home-based therapies that came around during the COVID era, and access to healthcare has been a problem, in some of the rural communities, and especially access to mental health providers is difficult no matter where you live. Just because of availability of clinicians and so forth. And we're seeing some tremendously high dosages. We had another colleague speak to seeing a dose when the records were sent over to his clinic of 1,200 milligrams being administered orally. We've seen 1,300 milligrams. So, there's this massive quantity of ketamine that is not necessary based on our experience.
I can embellish on that a little bit.
Sure.
Just so the listening audience realizes, if it wasn't clear from what Kevin was just saying, when you take that medication by mouth or intranasally, by any other route other than the intravenous route, meaning through your IV, when we start an IV on a patient, ultimately the amount that ends up in your blood is incredibly variable. And it's also always going to take a lot more to get to that point, as opposed if you just give it through a vein. When you give it through a vein, you get the proper level in your blood that you need to get that therapeutic effect. And we know it. And our protocols are very much developed, and they're tuned to optimize those results. And you could do that effectively with giving the medication through the IV. But when you go through the nose and the medication has to pass through other barriers, same with if you take it by mouth, you never know exactly how much ends up in the blood to get to the point where the medication can do what it needs to do. It can be all over the map.
Well, and you speak to the tailoring of the treatments. Again, one of the things that Mind Body Centers prides itself on, and we've done as protocols, and I've participated in a lot of these treatments, is the patient's response. So if you have a clinician or somebody who's trained responsibly to help guide that patient, the psychedelic community always talks about set and setting, and you got to get them into the right setting. You got to have reduced outside noise and reduced lighting and decreased stimulation, and allow patients to really kind of feel very at ease. But ketamine can cause that dissociation, that floaty feeling, and it can bring up emotions. And sometimes those things can become frightening, or they can become a little overwhelming. So with trained clinicians in the room with these patients, especially on IV therapy, you can redirect that patient to get them into maybe a better, more comfortable headspace. You can modify the environment to make it more comfortable for them. Or worst case scenario, you've got to slow the infusion down or turn it off momentarily to allow that patient to get out of that negative space to allow that patient to get the optimal result from the treatment. And we get patients all the time that will return to us who go to maybe an unsupervised treatment. Some people like it unsupervised, and I get that. But some people prefer knowing that if something feels a little too intense or not intense enough, that they just need to tap the clinician beside them, and we can modify that treatment to get them into the right spot. Mm-hmm. And yes, it does take some training. It does take some attention to your patient when you're sitting chairside. You can see them, getting anxious and starting to grab at their chair or flipping through their phone and looking for a different audio program or something like that. That elevated anxiety could be a trigger to making some modifications. And you're not going to be able to get that if you're not monitoring it. My other question to you, Dr. Murphy, is ketamine does have a very safe profile, but it does cause increased cardiac output. It can cause increased blood pressure, some cardiac irritability if there's an underlying, under some underlying heart type condition that can cause. In the situation with Matthew Perry, my understanding is he had a known coronary artery disease. Doesn't mean that he has arrhythmias per se or irregular heart rhythms. But could that, I'm not asking you to diagnose, but could his consumption of ketamine independently through a non-prescriber have caused a cardiac event that was also precipitated by hot jacuzzi water?
It's certainly an interesting question. And all we can do is hypothesize on the facts that we have.
Right.
When you talk about coronary artery disease, what that means specifically is disease in a patient's blood vessels that surround the heart, that supply the heart with blood. Your heart supplies blood to your body, for your brain, your liver, your viscera, your muscles. The coronaries are vessels that are unique to the heart itself, because the heart is constantly pumping and it needs a supply of oxygen through the blood to beat properly and take care of the rest of the body. So he had disease in the coronaries, number one. That is going to put him at a higher risk for a potential cardiac event, whether it be a heart attack where there's, what you call it, a blockage in one of those vessels, or if it's going to cause the heart to beat faster. And because those vessels have little obstructions in them, what we refer to as coronary artery disease, you're not going to be able to supply as much blood to the heart muscle because those vessels are compromised from the little obstructions that he has in there. This was a milieu that he was in. There was more than one thing going on. The hot water in the jacuzzi could have certainly will dilate. It will change, how your heart responds, because vessels around your body, dilate when you go in that hot water, and the heart has to respond appropriately, and maybe it wasn't able to. So there's that, and then the fact that his sensorium was altered by an inappropriate administration of ketamine. But nonetheless,
Sensorium. Just define
ketamine
sensorium
itself, and it's a well-known effect, is the part of your nervous system, your central nervous system, that says like your what they call your fight or flight response. If you're you're in the middle of a street and a car's coming at you and you go, I got to get out of the way here, your body will respond in a way that tightens everything up, that initiates a faster heart rate, faster respirations, constriction of blood vessels, et cetera, et cetera. Now, ketamine is known to cause that directly. So that's where the risk is, which is what I think you're referring to. Right. And it's called, without getting too complicated here, it's called a sympathomimetic response. And it's the flight or fight response. And that will happen from ketamine as a direct characteristic of the drug. And that's why it's so important to be monitored, because you don't want somebody that has a history of high blood pressure not monitored, because it can increase blood pressure. You don't want a patient with a history of an abnormal heartbeat that's going to have something that you can catch on monitor. But if that patient's not monitored on an electrocardiogram, you're not going to know what's going on.
Right.
This needs to be, ketamine is such a wonderful and effective drug, as we've known by in excess of 60,000 infusions that we've done. But we know when a patient is at risk, and all patients need to be appropriately monitored, especially as you get a little bit older, because these risks of high blood pressure and heart disease, just as in Matthew Perry's case, they put him at risk. And once again, all I can do it is based on the facts that I know as of now from the coroner's report. But he was at very high risk given his age, his health history, and being in a hot jacuzzi and not monitored. It was like this trifecta of a potential disaster. That's why, this medication, is effective as it is, it needs to be given properly. And beyond the fact, number one, it's all about safety and vigilance in these patients. But beyond that too is efficacy. But I just want, efficacy meaning, these patients, we want to get the best result. This is not about melodrama, but we don't want a patient dying from potential issues associated with their health problems in the presence of ketamine. And we certainly don't want a suicidal patient or somebody to be living life in complete misery. That's the balance we maintain.
Right.
So you're saying that there's like a candidate, that there's a screening that people have to do in order to get these, the ketamine and start doing infusion. You can't just be for everybody.
Finished?
No, go ahead.
The screening is essential. And the healthier you are, the younger you are, there's always issues, not only with health problems, but potential medication interactions. So I need to know, even from the youngest stage, and to a patient who's older, who may have a history of coronary artery disease or a multitude of other health problems, I need to know, because I have to use that judgment to determine if a patient can be treated safely. And I will specifically consult with other professionals, whether it be a pulmonologist, cardiologist, any of these other specialties, so I can know that this patient is safe, number one, to be treated, but also can be safely managed to get to the point where they can be treated. It's just a matter of making sure they don't have an irregular heartbeat, or that their blood pressure is under control. So,
well, the other thing, not to interrupt you, but the other thing that we look at too, obviously, is their mental health. It's obviously, from Matthew Perry's standpoint, medical is very important, but he's also independently reported, I'm not putting words in his mouth, but he's talked openly about his history of addiction. So there's definitely some mental health psychological assessment that needs to be done in tangent with the medical assessment. And while most psychiatrists, psychologists, will do an effective job in evaluating patients for their mental health conditions and so forth, but we want to make sure that the mental health assessment is specific to that patient as it relates to ketamine therapy, not to overstep and step into maybe there are other medications that they're receiving. We will review those to make sure that they don't interact negatively, or if any of the other medications we're going to give is appropriate. That's where Dr. Murphy evaluates and consults with the clinical staff. But Dr. Diamond, our clinical psychologist, reviews all of our patients' mental health background as well, with some testing that we do independently as well, just to confirm that from a mental health perspective, if somebody does have a high risk of addiction, that we make sure that they get surrounded by the appropriate support network that can either, if we're helping treat their depression, but they struggle with some addiction issues, we want to make sure that they have good support while they're going through their treatments and so forth, so that that doesn't end up becoming a secondary problem.
So Kevin, let me ask you this, given what you just said, and once again, as our more holistic approach at Mind Body Centers is, how does this relate to people who are dosing ketamine at home and not having the support group that you were just referring to?
Well, I've always been fearful, under our previous entity, we'll put it that way. There was a lot of discussion about doing home-based treatments, and I was never in a big support of that. I understand the safety and so forth, but I've sat chairside with patients for the last 8, 9, 10 years, and 98% of those patients do very well, very well. There's been a small handful of patients that physically needed somebody there who is medically trained to manage the anxiety response that that patient experienced during the treatment, whether or not it was making sure that they didn't harm themselves by ripping out their IVs, they didn't harm themselves by jumping out of the chair and running down the hall or something like that. There's still that risk when you're dealing with a dissociative. So my fear is, I'm sitting in Gilbert, Arizona, you're up in Scottsdale, Arizona. If I'm watching you and you're my patient and you start having a strong reaction to the ketamine that has been prescribed to you, how in the hell am I supposed to help you other than direct you, guide you to spit out the troches if that's what you're taking, try to make sure that there's, I don't know. I would feel very responsible and very uncomfortable if you all of a sudden got up and ran out of your house and I didn't know what you were doing. And I don't know, that's a different level of care that, again, my opinion, I don't like. I don't think it's safe at the dosages that we're seeing, at lower dosages and so forth, but everybody's unique. Everybody's so unique. So again, my opinion only as a clinician who sat in with thousands and thousands of these patients.
And then, and as a segue, and I think this kind of overlaps as a subset, but that would bode outside of safety, and maybe this, in essence, this is what you were saying, but in terms of the effective result of the medication, having these other parameters is something that has to be done, as we've seen.
We've, again, we, in a number of the states, again, with our previous entity, as we were opening up, some people couldn't wait to get in for treatment. They were pretty desperate. And they reached out to one of these home-based programs. And initially, they may have stated that they got some benefit. But over time, it seemed like the benefit that they were recognizing, and we see this even with IV therapy. Even if we start a patient at 0.5 milligrams per kilo on their first administration, many times, we have to adjust that dose individually between each treatment going forward, whether or not it's higher, whether or not it's lower, whether or not it's faster, whether or not it's slower, whether or not it's over a longer period of time. But a lot of patients maximize, what I hear is they max out their benefit that they can take orally at home, and they end up looking for an alternative. And many times the IV alternative, we can bring the dose down tremendously and actually get a much better response.
I'm in agreement.
I think it's safe for someone with addiction to start doing ketamine treatment, and knowing that there's at home, also possibly there are people, you know, in the streets just selling them like a drug, essentially.
Right. Right.
Would you be comfortable, treating those patients with addiction?
Talk a little bit about, because we screen everybody from a mental health and
Right.
fortunately, a lot of times patients, we want to treat them safely, similar to like what Dr. Murphy said. We want to be safe and we want to be careful. There's
Yeah.
certain street drugs that can cause increased cardiac irritability and problems there. And Dr. Murphy can go into that more directly if need be. So we don't want to make people feel bad if they're
Right.
using that. It is what it is. We just want to know so that we can make sure that we give them the proper direction, whether or not it's abstinence for a week, a month, whatever that is, making sure that they're in a proper support setting before we initiate our treatments. Again, it's not everybody deals with their own demons.
Right.
We're not here to judge them. We're just here to help them. And if we can help them, let's make it the safest way to do it with other medical supports, mental health supports, and community supports that are available to us.
Because the issue is now, once again, and this is why, medicine is an art, and it's not, it's just not a cookbook type thing.
Right.
A person who has an opioid addiction, if they're deep into their opioid addiction, all the ketamine in the world that we administer to them is not necessarily by any means going to break that patient's addiction. You have to identify the mental health issues that led to the addiction in the first place, make sure that you've got a venue to stabilize that. And then, once they have that addiction under control, say the heroin addict is now on methadone, then we can address and get an effective result from the ketamine. And the same thing goes for the patient who's a hardcore alcoholic. If that patient just continues to drink heavily on a daily basis, infusing them with ketamine isn't gonna bring them back around. You're gonna have to get those, and I'm not saying we got to get those patients stabilized to a degree so that the ketamine is effective, and that's where those other addictions have to be modulated to get to the point where we can make a difference.
We do some web-based testing with our patients, but it's followed up with an interview. So we do the testing because, again, depending on where they might not be lying. It just might be it's testing at that moment in time when they're sitting in front of the computer. Maybe they're in a great mood that day and their scores are really low. But through dialogue and further investigation, then we can find out whether or not the patient has been hospitalized, or if they have a family history of these things, or what medications they've tried, or if they've had a suicide attempt. So all those things go into this. So, and again, obviously we're having a lot of conversation about this, but this is not sadly, it takes a death of a celebrity like Matthew Perry to sometimes bring people out to talk about what they're struggling with. And I think mental health has always had a stigma attached to it. And it's become better over the years in regards to people talking about what they struggle with and being a little more open to it, but it still exists. I still have patients who will not do a Google review because they don't want their name attached to ketamine or to a mental health facility at all. And I get that. So if it was diabetes, they wouldn't have a problem.
That's true.
Right? If it was arthritis, they wouldn't have a problem. Nobody has a problem talking about physical afflictions, but when it comes to the brain, it's hard.
So do you think with his death, since it's such a big thing, right? And with this news coming out, and essentially everyone in the mental health, everyone in the ketamine kind of world are now talking about it, and more, I guess, more of the public who didn't really pay attention to ketamine or any of that are now finding out and learning more about it. Do you think this is a positive trend for us, or do you think that this will only um this will only worry more people, since they're already, some of them might be worried about ketamine before, or doubting its effectiveness or stuff like that?
Personally, I'm personally looking at this as a positive thing because it's going to bring about awareness.
Mm.
Keep in mind, if you think of all the variety of different types of antidepressant medications, anti-anxiety medication, with all the availability of other mental health professionals, people are still suicidal, dying at an incredible rate. Depression is prevalent. It's ubiquitous. Anxiety is always difficult for still so many people to control. And yet all these medications are available for them, but they don't work.
Right.
They don't work, or they have side effects. That's why people come to us. Because even though you have those particular, I want to refer to it as characteristics of ketamine, these aren't long-term side effects. It does that dissociative event and the other things that we discussed earlier. Yeah, they're there, but those are transient and gone within a few minutes. And that's the beauty of the drug. So these people don't carry side effects forward. It doesn't affect their personal lives otherwise. And it works, and it gives them hope. And when you have that patient who is hopeless and is giving serious consideration to ending their life, we can tell you that ketamine effectively intervenes when nothing else will. So there is a reason that ketamine is so ubiquitous, as I've mentioned, and people are turning to that. And Matthew Perry was turning to that, and he had a destructive, addictive behavior up until that point. And this was where what happened to him, it was a mismanagement of the drug. And even the mismanagement of the drug and all these other various factors that influenced it. So I just hope people, have a greater understanding. I hope it brings ketamine more to the forefront, and then we'll peel away all the BS that gets placed upon it, and show by our own extensive experience, our own extensive, wonderful results that we've had over years, that this is an excellent and safe therapy for people who are really suffering, and just not only suffering from the acute illness, but suffering from the ineffectiveness of the mainstream medications and or their side effects.
Do you have any other, comments regarding Mr. Perry's death, the reports, other than what we talked about, or any concluding thoughts on them?
I'll go first.
Yeah.
Certainly, we have, the entire picture isn't clear. And I think, number one, we really need to know what was going on where Matthew Perry got this additional ketamine. But, I have no doubt, and I will always, by the topics that were discussed today, it'll be very clear. I have zero doubt that it'll be very clear that Matthew Perry's death would have easily been avoidable, and absolutely unequivocally not directly linked to ketamine in any way. No doubt.
Right. Yeah, and obviously our goal here is not to point a finger at Matthew Perry passing away. Our condolences to his family and any of his loved ones and his friends and so forth. It's sad that we continue to talk about people after their passing and so forth, when he was, he was a big part of a lot of people's lives back when Friends was massive. I know every time I'm on a Southwest flight, it's always on the free TV that I sit there and watch, and I always get a good chuckle out of it. But no, I think, again, it's important. I hope we continue to dialogue about it. I think there's still a lot of wild west stuff being done out there, and I think that more and more we talk about there's very responsible providers out there, and maybe some that need to be a little more thoroughly investigated. But if people have questions, obviously they can email us hello@mindbodycenters.com. That'll come into one of us, and depending if it's medically based, we can get it off to Dr. Murphy. If it's clinic based or so forth, I'll be happy to answer it. But hello@mindbodycenters.com, it's plural. Or you can look at our website, www.mindbodycenters.com. Or you can always call us at 855-481-9605. Yes, I'm looking at it on a piece of paper because I haven't completely memorized it yet. 855-481-9605.
Perfect. Thank you guys so much for your time.
Hey, thanks,
Answering
Kathleen.
all these questions and talking about this.